Thank you for joining us. I'm Mina Nupbeam, Program Manager for the CORES program at SAFE, also known as Stewards of Affordable Housing for the Future. If you're less familiar with us, CORES is a certification that recognizes owner-operators and third-party resident services providers that have developed a robust commitment, capacity, and competency in providing resident services coordination in affordable rental homes. In today's webinar, we're exploring how resident services staff can develop and implement effective nutrition and food access programs within affordable housing communities. So we've heard from resident services providers that many residents are facing heightened food insecurity, and in response, resident services providers are developing and building food program partnerships to address this priority and support resident health and well-being. CORES really recognizes the importance of building trust and engaging residents in the design and implementation of nutrition and food access initiatives. Ensuring you're creating formalized partnerships with mission-aligned program partners ensures that you're able to sustain and scale those partnerships. So this webinar will highlight an exciting partnership between Mercy Housing and Share Our Strength, which demonstrates how collaboration can strengthen outcomes for residents and provides you with a playbook to support nutrition and food program development and implementation at your own organization. So before we get started with today's conversation, I would just want to discuss some logistical items. Next slide, please. So before we get started, just feel free, as I said, to introduce yourself in the chat if you haven't already, or share other resources. Today's recording and slides will be made available after the presentation, and any resources we mention as well. If you do have questions, please try to use the Q&A function so we can see those when we get to Q&A later today. And with that, I'm really excited to pass things over to the Share Our Strength and Mercy Housing team for today's conversation.
Hi, everybody. I'm Julie Garcia. I'm the Associate Director for the Health Systems team at Share Our Strength, No Kid Hungry. And just want to say what an honor and a privilege it is to be here today with you all. Super excited about sharing this playbook with you all and celebrating the great work of Mercy Housing with our Nutrition and Housing Initiative. Just real quickly, want to introduce myself again, Julie Garcia. I have been mostly leading this initiative for Share Our Strength and working alongside Mercy Housing. And behind the scenes is my colleague, Elena Reese, who is our manager of our health systems team. And Elena has been instrumental in helping to design the playbook as well as this webinar. And on the Mercy side, I'll pass it on to Teresa.
Thanks so much, Julie. I think we're on the next slide. Oh, maybe not. There's a third slide that's introduction slide. There we go. So hi, everybody. I'm Teresa Palmer. I work with Mercy Housing. And just a little bit of information about Mercy. If you're unfamiliar, Mercy Housing is the largest nonprofit affordable housing provider in the country. We develop operate and finance affordable housing across the country. We're currently operating in 22 states and have resident services staff in about 75% of our buildings. We have about 350 buildings across the country and serve 45,000 residents every day. Our team who's presenting today is Kylie French, who's been helping lead this work on the Mercy Housing side, and Hannah Wolf, who's been one of the direct service providers. So we're thrilled to have them as the presenters for the bulk of our material today. I think, do we go back to
maybe let's go back to the poll slide for a second. And I think we can sort of start off with a quick poll, which I'll launch now. Just curious to see who is currently in the room and your experience with food program partnerships. So I'll give folks a few minutes to complete that. Okay, I'll go ahead and give it 5 more seconds here. Okay, so it looks like we have a good mix actually. So some folks were sort of starting to explore this type of programming. Others were identifying partners or have launched and are refining. So yeah, that's a really great mix. And it looks like maybe, the majority of folks by a little bit here have not scaled food program partnerships across multiple properties. So that's interesting. Thanks, everyone.
I think we can advance to the next couple of slides. There we go. Perfect. All right, well, let's talk a little bit about our agenda. So we talked about who we are, and just real briefly about Share Our Strength. We are a national nonprofit, and we are focused on eradicating childhood hunger. And we do that through a number of initiatives. Some of you might recognize us through our work with our No Kid Hungry in our state teams and our focus on school meals. And so breakfast in the classroom, school meals, non-congregate meals. Uh, and we also have some amazing community work as well. And this is where this body of work lies, is in our community work. And we've been, very fortunate to work alongside some amazing partners within the community. So again, Share Our Strength, No Kid Hungry. But from an agenda perspective, we're going to talk a little bit about why nutrition and housing. Why did we focus on this particular initiative? We'll also talk about briefly about SNAP. And in California, CalFresh is the term that it's used. Just talk a little bit about that. Um, we do have a framework, a six-step framework that we'll be presenting to you that we feel is a really great way to kind of structure this type of work, and gives you, outline steps to take when you want to implement something similar to what we've implemented. Resident voices are a huge piece of this initiative, and it's integrated as a theme throughout this initiative and throughout the playbook. So you'll kind of hear that woven into to this webinar, and also as you review the playbook, woven into the playbook. We'll also talk about partnerships and how important it is to establish partnerships within your community, and how important they are to the services that you provide to your residents. And then finally, we'll finish off with talking about scaling and sustaining these nutrition efforts. Next slide, please. All right, so uh, the origins of our nutrition and housing initiative. So I'm going to take us back a few years. In June of 2022, Share Our Strength, No Kid Hungry, launched its nutrition and housing initiative with two major housing developers, Mercy Housing being one of those. And I think I see a partner of ours who we worked with previous, NHP Foundation, on this call. So excited that they're here. Our work spanned 3 states and 4 cities, focusing on expanding access to nutritious food and strengthening food security across the housing communities. We work directly with three Mercy sites: Gleason Park in Stockton, California; Esperanza Crossing in Esparto, California; Savannah Gardens in Savannah, Georgia; and our NHP partner site was Clem Manor in Houston, Texas. And at the core of our programming was our focus on advancing sustainable, resident-centered strategies. In other words, it was extremely important that solutions didn't dissolve when our support diminished, but that many aspects of the work be sustained and hopefully replicated across the portfolio while we worked alongside resident service coordinators, and resident voice was at the core and center of the work that we were doing. Now, given that this was a multi-year project, you can imagine there were many different iterations. And today we're highlighting the last iteration, which is focused on streamlining the SNAP, or in California, CalFresh, application support process. We're excited to offer you all a playbook at the end of this webinar, which hosts a framework of tips and tricks available to you if you're interested in implementing a similar type of initiative. Next slide, please. So earlier I spoke to I just spoke to the origins of nutrition and housing. And, we had this hypothesis and that hope that as residents' housing security was met, that we could also impact food security. And we understand that the relationship between housing and food is somewhat complicated. And also, we know that there's often, and especially in these times, some hard decisions that are being made. And food is one of those needs that isn't necessarily set, and it is adjusted based on a person or a family's circumstance. For some families, there's often hard choices that are being made between paying a utility bill or buying food. And I believe wholeheartedly that eating nutritious food should not be a luxury for some, but a right for all. So, why does this matter? Why does this work matter? In a nutshell, combining nutrition efforts within affordable housing communities helps with resident stability, builds community resilience, supports health and well-being of residents, and it helps put children in a position to thrive. Next slide, please. So just a little bit about SNAP. Again, as this nutrition and housing initiative evolved, Share Strength had an internal pivot around our goals, and SNAP became one of the areas that we were focusing our efforts on. So initially, we were looking at more broader type of food access activities. And as this initiative evolved, we really zeroed in on SNAP and again, CalFresh in the California area. And we evolved our activities to revolve around streamlining the SNAP support process while reducing the stigma associated with applying for and using federal food benefits. Most of you are probably familiar with SNAP, so I'm not going to spend a lot of time talking about these fundamentals. You can read those on the screen. But I did want to highlight a few important aspects of SNAP. So, SNAP participation reduces food insecurity and poverty nationwide. And research shows that SNAP is the nation's most important anti-hunger program and significantly reduces food insecurity and poverty among low-income residents. SNAP serves an average of 41.7, almost 42 million people per month. Let's let that sink in. 42 million people per month. And that represents a little over 12% of the US population. Children make up almost 40% of SNAP participants. So just going to highlight those three points. And we know that the political environment right now is making it a lot difficult for many families to gain access to and sustain their SNAP resources. So, one of our goals is to try to assure that those who qualify for SNAP actually get enrolled and participate in SNAP. Next slide, please. All right. So um, we, in this playbook and in this webinar, we have set the stage for what our work in the Sacramento region look like at a high level. And we'll walk you through what these 6 steps look like in terms of an implementation framework. And again, we believe that this is a great resource that should help you if you are interested in implementing a similar type of project. Now, it's important to note that this is just a backbone for implementation. It's not a rigid script. Each property should adapt your approach based on your residents, your partners, and your capacity. Now, Kylie and Hannah will discuss the steps in a little bit more detail, but just want to highlight the steps briefly. The 6 steps include building support, understanding your residents' needs, developing a plan, exploring partners, taking action, and celebrating and sustaining your efforts. And with that, I pass it on to Kylie French with Mercy.
Yeah, thanks, Julie. Can we move? Thank you. So, one of our first lessons from this initiative was that building support had to come before programming. Resident services staff have a unique lens because we have trusted relationships with our residents, and we also have a front row seat to the challenges that our families face around food security. So we see how food security impacts health and stress, school success, and even ultimately housing stability. But we also know that the reverse is true, that when families have reliable access to food, that stability creates positive ripple effects into many other facets of our residents' lives. And because of that, we built a shared approach from the start by identifying champions across our resident services team, our site team, and resident leaders, while being clear about the roles and the boundaries so that not one person had to carry all the work alone. So, as we launched health fairs across 10 different sites, this became a true team effort. So, sharing responsibilities and building on staff strengths, that allowed us to create more sustainable work, or a framework for future resident engagement. And, ultimately building support isn't about adding more work to one person's job. We already, we already have to wear so many hats and step into many shoes. So this was about creating shared ownership that strengthens resident stability. But building that support created the foundation, but having the right people sitting at the table is only part of the equation. So the next question became, how do we make sure that our efforts are actually aligned with what residents need? And that starts with listening. And can we move on to the next slide, please? So once we built support, the next step was making sure that our work reflected what residents actually need, not what we assume that they need. So at Mercy Housing, we always start with listening. One of the ways we do that is through a annual or a biannual health survey. And that gives us a lot of data to understand the food security and access to different resources around food like WIC and access to food pantries and programs such as CalFresh or SNAP and healthcare coverage. But those surveys, while they provide valuable data, they're only just part of the story. So the real insight comes from our everyday interactions and our community meetings and just our, casual and informal check-ins on a day-to-day basis. So resident services staff, we hear directly from residents, and in real time, we're able to provide feedback. And when we combine that data, we could, with our relationships that we have with our residents and getting their feedback, we could get a fuller picture of what supports them in their stability. So understanding residents' needs, that gave us the data and the insight, but we also learned that that information alone doesn't drive participation. Even when resources are available, engagement still depends on something much deeper, and that's trust. And can we move in and we'll discuss a little bit more about what drives, how trust drives participation? Thanks. So one of the biggest lessons from this work was that data alone doesn't drive the participation, that trust does. And residents might qualify for services and resources, but without trust, that engagement can remain low. And that led us to another important question, which is what builds trust and what unintentionally creates barriers. And, we already know that trust grows through our relationships, repeated touch points and consistency. And residents are more likely to engage when when outreach happens close to home and when outreach happens in their preferred language. And also, very importantly, when messaging centers on residents, not the program. So residents engage when they feel like they're treated with respect and with dignity. And at the same time, trust can be unintentionally broken, and that could take place through public conversations about personal information, finances, and complex documentation that could leave our residents feeling vulnerable and exposed. So, and we found that to be especially true during recent political policy changes for our mixed status families. Um, the concerns that they had are real, and they influence whether our residents feel safe even seeking support. So when we recognize and we're sensitive to residents and their experiences and their concerns, we find that more doors open to those conversations, and more opportunities can come about to connect our residents to resources that support them. But ultimately, trust isn't just an add-on service delivery. It's an infrastructure that makes the service delivery possible. But we also found that once residents are interested and ready to engage, we started to ask the question is, how do we turn that interest into action? And with that, I'm going to turn it over to Hannah, and she'll walk us through how we moved into execution.
Yes, hello. My name is Hannah. I am a resident service coordinator with Mercy Housing at two of our family properties in California, and was able to be part of this process. And I'm really happy to be able to share out the steps, because as a resident service coordinator, being able to be really intentional not only helped my work to be able to serve residents better, but it also helped like our team approach among resident service coordinators in our area, and then just having that solid partnership with the food bank. So really happy that we're able to share that out. So like Kylie said, the first two steps were I kind of paying attention to what are the needs, and then also what are the supports that we can tap into. And from there, develop a plan of action. So making sure that the goals that you have are clear. So if it's, our goals were SNAP enrollment. So we wanted to make sure that the residents that could apply for food stamps did. So that was kind of our goal. And then also health fairs. That was also kind of a tool that we used to do that. So making sure that what goals you want, if it's providing more food resources, if it's this SNAP education, whatever it is, that goal is really clear. And then breaking that kind of project down into smaller steps. So for us, we decided that our goal of increasing SNAP enrollment would be through hosting health fairs. So with that, kind of breaking down that larger project into manageable steps, it can be very daunting, and it's hard to know where to start. So kind of breaking it down makes it easier to address. And then with that, it also is helpful to help assign accountability. So knowing what steps need to happen, such as outreach or advertising or food or setting up kid activities, whatever it is, having those small steps really clear and broken down helps to be able to assign that to whether a resident or other staff at your team. Setting deadlines is really helpful, and that just really helps keep the momentum moving forward. So, we had set our goals for, we met in the beginning of the year, and I didn't have a health fair until say October. And so it was really easy to kind of forget when your goals are so far away, but really being mindful of what needs to happen before the event. And then monitor and adjust. So things may take longer than you thought they were going to, kind of just always readjusting that. And then getting feedback as you go. So if it's a, informational series that you want to do at your site, after the first one, kind of connecting what's working, what's not working. We did that often with our team as one health fair happened, because we did a health fair each month. So after each health fair, we kind of regrouped what worked, what didn't work. And And then we're able to kind of monitor, okay, well, how are our CalFresh enrollments going? Okay, well, now we can focus on making sure people are reapplying, doing their right paperwork. So doing always adjusting as you go, and then creating tools that you can use to help with that, whether it's something digital, something on paper, a mind map. We used Google Forms to help us track stuff with our agencies and our enrollment. So finding something that works for your team, and how are you tracking all of these things? And on the screen there is a little bit of an example of, here are the actions, here's kind of our timing, who's responsible, who are the partners, and then what's that status. So you have some sort of way when you're checking in each, whether it's weekly or monthly, that you can kind of keep coming back to, having some sort of tool to help you do that. And hopefully some of the tools here will help with that as well. So next slide. Also being mindful of what works and what doesn't work. Kylie did highlight some of that trust, capacity, and kind of follow through points, but just making things that there were reoccurring touch points, that it's not one-time enrollment. For example, I was working with a resident who had paused her SNAP benefits because she was working on paperwork for her mom. And I didn't know that, but had I just done a one-time event, I wouldn't have known that. So making sure that we're having reoccurring touch points, that we're constantly talking with people because they may lose jobs, they may have kids. It's really important that it's not just a one-time push, that we're really finding ways to keep that connection with residents. Warm referrals. So having those strong partnerships that Kylie will talk about more too of developing. We had a really strong partnership with the Sacramento Food Bank. And so it was really helpful for me as a resident service coordinator. I would just give basic information to them, and they then would take it from there, and that communication piece. And so it didn't add much work to me at all, because things that they are experts in, I didn't have to take time to figure out. Like, they would just let me know, like, oh, we need this document. And I'd be great. So really keeping those warm referrals, and then also keeping it partner-led enrollment, that they're the experts. And then just resident center events. So making sure that what residents need, what they want to see happen at their property is happening, and then just following up too. So we had, they really liked the blood pressure check at one of our health fairs. And so that was something we were able to implement this year as well. So just keeping things resident centered as well. Thank you. Next.
All right. And so as we developed this action plan that Hannah actually beautifully put together in a form of a toolkit, we're quickly learning that how we engage residents matters just as much as what we offer. So we found that having those reoccurring touch points and providing warm handoffs or referrals and events that are resident centered, that consistency worked because they built relationships over time. And what didn't work well was, as Hannah mentioned, that one-time enrollment push or approaches that placed too much burden on staff, or even residents alone. But just having those reoccurring conversations and weaving that into other touch points that we're having with residents was what worked the most, is just taking on more of a holistic approach. Those lessons, they naturally led us into another important question, which is like, what are we actually saying to residents about CalFresh, and how do we communicate in ways that build confidence rather than create barriers? And so this slide is really about the power of messaging. And one of the biggest lessons that we took away was that housing staff don't need to become eligibility experts. Our role isn't to determine who qualifies, and it's certainly not to provide legal advice. Our role is just to increase comfort and dispel some common myths around SNAP and connect residents to the enrollment experts that we vetted, and we trust that they're going to provide them with the guidance and navigation, and just trusting that that is what they do best. We found that simple, resident-friendly language goes a long way. So messaging should normalize participation, but it should also protect resident privacy and and it frame it in a way that CalFresh um, is a support for both health and for financial stability. So, two myths that kind of repeatedly surfaced in this work. And one of those was essentially that the benefit isn't worth the paperwork, or some residents put it as the juice isn't worth the squeeze. So these conversations actually opened door to broader discussions. And we talked about how CalFresh can free up household resources for rent or utilities or other essentials. So, even if it might be $40, that still can go a long way because the SNAP benefits are a gateway benefit that might unlock additional perks that residents may not have known about. And some of those perks might include discounts and additional programs and resources. So, but sometimes residents weren't declining because they weren't interested. They just simply didn't have enough information to understand the value of what we were offering. Another myth centered around safety. And some residents had concerns related to immigration status or ICE or potential consequences of applying. And these fears are real, and they deserve to be treated with respect. So, as housing providers, we recognize our limited scope. We're not qualified to provide that legal advice, but instead, we reframed the question of like, should we push enrollment? And if we do, what are some things that we need to be mindful about? We don't want to dismiss residents' concerns or their experiences, but we do have our trusted partners. We have vetted, for us, it was the Sacramento Food Bank and Family Services who are staying on top of this information, and they can navigate that. And we could provide that warm referral and feel assured that our residents were in good hands. So ultimately, effective messaging wasn't about persuading residents to enroll. Our goal kind of shifted to more encompassing that success was more so about creating trust and clarity and creating safety for residents to make those informed decisions for themselves. But clear messaging, it does help to build that trust, but trust alone isn't enough. Residents also need access to the right expertise and resources. So that's where partnerships became really essential. Next slide, please. So as we move into this next step, we're really shifting from building internally to leaning into our collaboration with partners. And the key here is simple. Partnership doesn't just support the work, but it expands what's possible for our residents. Instead of starting from scratch, we begin looking at what we already have in place, what already exists. So in this work, we worked with our health and wellness specialist to map out existing partnerships. And it was clear that there's already a strong ecosystem in place. We already have connections to various food bank partners, community-based organizations, and the opportunity is really about connecting residents to those supports more intentionally and consistently. We also learned that when we're thoughtful about the type of event experience we provide for our residents, that can drive impact. So our virtual spaces, we did have a virtual fair, and that turned out to be especially helpful in our rural communities where transportation could be a barrier. It also gave families flexibility to participate on their own terms and on their own time because we recorded it. And in some cases, for like senior properties, they created a watch party so that they could participate that way. And then our in-person events, we found that they were really just more engaging. We were able to make them more culturally relevant And those provided opportunities for community building. And it just seemed more inclusive to all the different ages. We could have fun activities to include the youth and people of all ages. So, but messaging and visibility also played a big role. Social media helped us share information with the goal of normalizing SNAP enrollment. And by using our partners' social media platform, we were able to broaden our audience. And we found that the storytelling piece was especially powerful. Um, some of our residents, our families shared their SNAP experiences through short videos captured by our partners. And that helped normalize participation in a way that felt really real and relatable, and it still felt dignified. And then there's the partner organization wish list, which really comes down to clarity of roles. So, who provides the SNAP information? Who helps screen for need? Who supports the referrals and the scheduling? And make sure that residents stay connected. But making those expectations clear so the system works smoothly for everyone was really helpful. And one consistent theme from our RSCs that we found was that convenience really matters. So when services are on site and they're within steps of residents' doors, if they're built into daily lives or around residents' busy or families' busy schedules, participation increased. So transportation and competing priorities are real barriers. So taking those into consideration and being able to adapt accordingly made a big difference. But that's why the action plan template is so helpful, is it brings those roles and the timing and the partners and those next steps all into one place, so that doesn't have to burden one person or live in one person's head. So overall, this step is more about moving from doing the work alone to doing it in partnership, with intentionality and in a way that centers residents. And can we go to the next slide?
And before you jump into that, I just want to say, remind folks we're using the Q&A for questions. So if you do have questions, put them there. And we're going to try to leave about 10 minutes at the end to answer your questions. Thanks.
Yep. So thank you for that. And as we think about the roles of this work, clarity is really key. So keeping the roles clear, that helps protect staff capacity and make sure that residents can receive the right information at the right time. And this table is one of the biggest lessons from this work is resident service coordinators and community partners. We play different roles, but they're complementary to one another. So our goal isn't for one group to do everything. It's for each group to do what they do best. And, as it comes down to it, is our resident services coordinators are connectors, and our experts, we leave them to do exactly that, is just to be the expert on enrollment qualifications and navigating that process and being able to answer any concerns that residents have. But when these roles are clearly defined, our partnerships become more effective and sustainable. And one of the biggest lessons was just how essential these partnerships are to our long-term success and sustainability. And then can we move to the next slide, please? Thank you. So we learned in this work that strong partnerships are not an added bonus. They're very essential to making the work sustainable. And the reality is that no single organization can meet the full needs of our residents alone. Housing providers, we bring the trusted relationships and the deep understanding of residents and their communities, and our community-based organizations, they bring that specialized expertise and additional capacity. So when those strengths come together, we create a stronger support system for our residents. And our community partners, whether they're food banks or healthcare providers or local nonprofits, they can help bridge those gaps in ways that housing teams often can't do alone. Whether that's through benefit enrollment support or nutrition education, food access programs, um, or culturally relevant services that meet residents where they're at. But just importantly, partnerships do help. They help to distribute the work. So resident services coordinators already balance so many different responsibilities that through this work, we we came to really trust and appreciate that our trusted partners reduce a lot of that pressure on staff while ensuring that our residents are in good hands. Um, we also learned that those strong partnerships create more of a holistic support around residents rather than placing the responsibility on just one program or one person. And when that ecosystem's in place, nutrition efforts become more accessible and more responsible to the community needs. Um, but by this point, we've done a lot of behind the scenes work, listening to residents and building trust and creating those partnerships. And that all expands what's possible. And so then we kind of look into the next step of is like, what does this actually look like in practice? And how do we take all those pieces and turn that into meaningful opportunities for residents? And with that, I'm going to turn it over to Hannah to expand on that thought more.
Yes, thank you. We can go to the next slide. So step 5, take action. So like Kelly said, there's a lot of work that goes into, excuse me, what before we do the event with residents. So being mindful of how can we really take the action and all of the thought and planning that we have done to get here. So keep, make sure that we're having pre-planned programs and events so that we're doing those. If it's getting residents to help with setup or whatever it is, keeping communication with residents and partners flowing throughout. So if you're doing a series of events, if you're doing a one-time event, it's a follow-up or having conversations with them, tracking progress. So each step that you've done that action plan, so tracking your progress, so you're marking things off on your checklist and are making sure that you're kind of sticking to all of the thought that you've put into it. Identify bottlenecks, so anything that pops up. One example that we had for our health fairs is we realized some spaces can't hold as many vendors and many partner agencies, so we kind of had to be like, oh, let's think about that. Should we do it indoors? Should we do it outdoors? Should we invite less community partners and focus more on just the SNAP piece? So addressing any roadblocks that come up through your events. And then I think also documenting is really important. So it's really easy to forget after an event, after everything is done, what steps you took, what worked, what didn't work. So being intentional to have that time to debrief as a team. We made event reflections that we were able to give out to all of our community partners to see like what their thoughts on the event were, what their highlight interaction with a resident was, how many residents did they talk to. So we were able to get feedback from our community partners, and then we're able to implement that into for future events that we were doing for outreach. And then just also, the pro tip, mining capacity. One thing that I did from this entire project, realized that we do have so much capacity. There's so many things that resident service coordinators do, but being really intentional with going through these steps to identify those partners, to have those outreach events, it only helps us have more capacity because we're identifying, who are our champions, who are our experts. And so I think that was something for me personally that was really helpful and highlighted that I want to keep doing this step for not just food insecurity, but health with housing stability. There's so many ways that, with capacity. So we can go to the next slide. So entry points. So events should open doors to ongoing systems and are not standalone as the whole strategy. So being mindful, there are a lot of different ways that you can accomplish your goal. So we've talked about the health fairs that we've done. Kylie mentioned the virtual health fair that we were able to do to get the information out to people, social media, the videos that we made with residents and the Sacramento Food Bank. Just being mindful that there's a lot of ways to accomplish the goal that you set for yourself. So with that, I'm going to pass it off to the next person.
Thanks, Hannah. Um, so with regard to sustainability and celebration, as with any initiative, the goal is after support diminishes, that there's a system in place that supports the sustainability of various aspects of the initiative. And ways to create sustainability are one, crafting policies and practices that embed aspects of programming into systems that we build in continuous learning opportunities for residents so that they stay informed, especially as new policies and regulation and expectation are implemented. And we've seen that in particular recent with the new HR1 work regulations and work requirements. So having those partners that can help provide that continuous learning for your residents, I think is an essential piece to this part of programming. Implementing an evaluation system into the process that doesn't need to be extremely elaborate, and it can be as simple as the PDSA concept of plan, do, study it, and then act. And so that can look different in different ways. Planning, obviously, implementing, studying could be something as simple as adding in feedback forms into your programming and then taking that information into account and then acting on that feedback. Checking in with residents regularly, building systems and programming alongside residents and not for residents, I feel is a really big part of the success of the initiative that we've developed here. And as you all know, residents can tell you exactly what they need. And then finally, celebrate success. And I think so often we get caught up in the doing that we often forget that the celebrating is really what helps us, feel really good about what we've done, and celebrates the people who really were working hard, either behind the scenes or on the front lines. And so, with that, I ask that you all join me. If you have the ability to indicate some kind of an emoji or celebratory response. Mercy Housing has been absolutely amazing to work with, and so have Hannah and Kylie. And I just want to take this opportunity to celebrate the great work that they've done, and the amazing work that Hannah and Kylie have put into this initiative. So thank you both. Thank you all so much for all the great work that you've done with this nutrition and housing initiative. And with that, I think I pass it back to Kylie.
Yeah. Thanks, Julie. I appreciate that. And as we move forward, even though like this project has come to a close, it's really important to make sure that the work that we're doing, everything that we've started with our residents, building this trust and having these conversations, that this work is sustainable, that it's going to continue. And so we start to look at how to scale this across sites and make sure that we don't lose ground that we've made. And so, one of the biggest takeaways is that scale doesn't mean replication. So, it's not about copying one site exactly. It's about building adaptable systems that could work across different communities and can also work across changing times. So, we found that it helps to standardize having a backbone, but also allowing room and intention to be able to customize the local approach because we recognize that every community is different and each community has its own type of culture, and we need to respond to the needs of the needs and interests of those communities. So we don't, we want to make sure that the work isn't rigid, but it's more built in to give us the framework, to give us the stability or the structure, but also allowing us to customize things for our communities. Um, but we also learned the value of low burden tools. So, and that was something Hannah was so great in building out for us, was just to have those systems that can be improved over time, and that partnership with the Sacramento Food Bank and Family Services. It was really one of the amazing takeaways was the value of having that referral pathway, and to having that feedback loop, so both sides could benefit. It helped to reduce those bottlenecks in the enrollment process, so we could provide the warm handoff. But if there's something that's, a application is hinging on, Rocio could reach out to us, let us know, and we could respond with the resident and help support so that they could push their application through. But that was really important, was having that really reliable referral pathway. But the bottom line is that scale comes from having those adaptable systems, not from expecting every site to look exactly the same. So as we think about scaling, it's equally important to look at how we define success, because in the beginning, our goal was really about CalFresh or SNAP enrollment, but we started to miss many of the outcomes that really matter most. And so we had to really broaden our definition of success over time. And so one of the things we learned was that most or many of our residents that qualify for CalFresh or SNAP were already enrolled. So, and that's a good problem to have. But it also opened the question of like, what other successes might we be missing? And so, that really broadened into looking at how we educate residents about SNAP benefits, or how we support them in the recertification process, or there's changing requirements, and how are we supporting our residents through that? How is the engagement, and how are the partnerships looking as far as sustainability in this work? So at the end of the day, the work was so much more about the benefits enrollment alone. There was meaningful change that was taking place, and it often started with, it started small. It starts with one site, one intervention, and one partnership at a time. So with that, I'm going to hand it over to Teresa, who will close us out by sharing some practical next steps.
Absolutely. So we're hoping that you will access the playbook. The CORS, it's in the CORS resource library, so you'll be able to use it from there. You're not alone. There's lots of organizations that like Share Our Strength and your local food banks who are really quality resources for you. And so we really encourage you to reach out to those folks. And you can also get a hold, contact Julie or myself. And you can reach me through CORS if you since my email is not on here, but we'll get that updated and send it out. We're happy to provide resources if you have other questions. And I know is there one more slide?
I think there's one more. We can just pause here on acknowledgements for a few
Yeah,
minutes.
so there's a few folks we just want to acknowledge. We know you've heard from Kylie and Hannah. Parag Gupta is our former Mercy Housing Chief Program Officer. He actually made the original connection for us with Share Our Strength, so we like to send out our warm thanks for him. And Eric Kringle was a resident services director at Mercy Housing, who we lost last year to cancer, and we hold him deeply in our hearts with this work. So we just like to make sure that that we call that out in his memory. Rosario and Kevin at the Sacramento Food Banks are continually our partners. We wouldn't be able to do this without them. And finally, Elemental Advisors, Sarah and Rain helped create the playbook and the webinars, and we have a lot of deep gratitude for them as well. So with that, I think we're ready for questions.
Thanks so much, everyone. Just looking to see if there are any. It looks like Julie answered some of the questions in the chat. Maybe Julie, if you just want to call out any information from there, if folks have other questions, please feel free to put those in the Q&A.
As people are typing, I think the one area I'd just like to highlight is the fact that the playbook does have an appendices with many of the resources that were discussed today. So I think I saw there was a request for a copy of the flyer that was used by Mercy Housing, and there was also a request, maybe more information on how to work with rural communities. And I believe we have something in the appendices that talks about the virtual fairs, wellness fairs that were conducted. So, we know that for many rural communities that the support and the resources are not as robust as our larger cities. And so maybe for rural communities, it might be, more feasible to host a virtual fair. There's a lot of logistics that go behind the scenes to assure that that is done and done with fidelity. But I think at the end, what we found was that many of the residents were extremely happy to have the support and the knowledge, and that the partners were also very happy with the setup because they didn't have to travel to that location. They could just jump on a Zoom call. I think they were able to break out into breakout rooms, and it sounded like it was just a great way to provide that support and resource information to the residents.
Thanks.
I think we might have time for one more question
Yeah.
if somebody wants to ask.
It looks like everyone got their answers, it seems like. Thank you. Thanks again, everyone. And Amy, can you advance 2 more slides, I think, real fast? I just want to share these resources as well. We'll share again the playbook, contact information for those that want to get in touch with folks. And but also just want to share some resources from CORES. We have these CORES webinars quarterly, so feel free to sign up to our newsletter to get updates on when those will be happening. And we also just started having CORES office hours as well, so I can share more information on that in follow-up. But thank you all again so much. This information is really valuable and really helpful to folks who are, just starting this process, as it seems like many folks are, and also those who are already have these programs but are looking to refine and scale. So really appreciate you all taking the time, and thank you all so much. I hope you have a good rest of your week.
Thanks, everybody.
Thank you. Bye.
Thank you.